This is the first part of the bioterrorism lecture. It's a two-part series. There's like 30 something slides. We're going to get into some different types of terrorism and different types of agents. Don't think that you're going to have to know everything that's on these PowerPoint slides. If you take a look at generalities like all of the vesicants, you do this. All of the chemical agents, you do this. All of the gases, you do this. That's the kind of information you'll be tested on. Terrorism is defined as any unlawful use of force or violence in furtherance of political and social objectives. It can be international, like 9/11. It can be domestic, like the Oklahoma City bombings. Um, it can be even internal, as far as somebody doing something to the hospital or to a school. Chemical attacks usually, more commonly, are arsenic smoke, sulfur gas and mustard gas, or sarin gas. There were some sarin attacks in subways not too many years ago in China, and I believe in London. Arsenic smoke, people who smoke cigarettes, you're giving yourself arsenic poisoning. Just thought you might like to know that. Biological attacks, arsenic and sarin can be considered biological. Punji sticks, usually these are used in times of warfare. Punji sticks were used in Vietnam especially. They were hidden. They were sharp sticks that, and they could be placed in rivers and creeks in the jungle. And what the enemy would do was they would contaminate the ends of the punji sticks with feces or bacteria, so that if a soldier fell or stepped on a punji stick, they were contaminated, they were infected, and it was a very slow, very agonizing way to harm somebody. There's also radiological attacks. Think of Hiroshima and Nagasaki. We've had numerous radiological accidents over the years. Chernobyl. People have had suspected radiological poisonings and have had increased incidences of cancer, leukemia in those areas, although the government will always say that they've never really proven anything. Um, you know, you kind of wonder. Explosive attacks, just like I said, the Oklahoma City bombings, the World Trade Center attacks, 9/11. Also, you can have dirty bombs. The bombs are loaded with anthrax or sarin. Those are considered dirty bombs. Nerve agents. Um, a few years ago, I attended a bioterrorism summit in Greenville, and they would not even say Agent VX in the place, because at that point in time, if you Googled Agent V or VX, you got a knock on your door from the people from like Men in Black asking you why were you doing that. So evidently there's something out there that's even more dangerous than VX now. So nerve agents, VX, sarin, soman, tabun, and there's one called GF. Sarin's very highly toxic, and I'm just going to talk about one. Then it can cause death within minutes of exposure. It enters the body through the eyes and the skin, and it acts by paralyzing the respiratory muscles. So, you with sarin, you don't have very much of a chance. With nerve agents, you take a look at sludgem. That's the mnemonic: salivation, lacrimation, urination, defecation, gastric upset, emesis, and meiosis. Look at meiosis. It does not have to do with cell division like you learn in biology. Dim vision, cardiac dysrhythmias, runny nose and shortness of breath, pinpoint pupils and muscle fasciculations. What are fasciculations? That's going to be important when you do part of your neuro stuff. Treatment, oxime reversal agents. If you take a look at the chemical name of these things, it ends in oxime. There's a 2-PAM chloride, which is potapam. There's a Mark 1 kit, which has atropine and potapam. Valium, full decontamination of body and clothing. When you're hired at hospitals, you will have to go through orientation, and you'll go through what do you do for a radiation exposure mass casualty, and part of the thing is a full decontamination of the body and clothing. Also, you want to hydrate these people, reassure them to decrease anxiety and promote rest. Vesicants, you think of chemo. That's what the first thing that pops into my mind. But vesicants are gases. Um, they can cause severe respiratory problems. They can cause blistering of the skin, just like a vesicant if it infiltrates. Mustard gas is yellow to brown in color, and it has a garlic-like odor. Phosgene is a colorless gas, and it's normally used in chemical manufacturing. So there's things that we use every day that can be used as agents. The vesicants cause eye irritation, skin erythema, blisters, mucosal sloughing, and airway obstruction, and they can cause bone marrow suppression. So what happens if your bone marrow is suppressed? There's your symptoms. Treatment is supportive. You know, that's about the only thing you can do. Blood agents. Excuse me. Let me go back. Blood agents: hydrogen cyanide, cyanogen chloride. Think of your secret agent men who had the cyanide capsule that they kept in their pocket and they bit down on it. With cyanide poisoning, you have an almond odor to your breath, you have a headache, you're dizzy, nausea, confusion, hypertension, and bradycardia. That's the initial symptoms. Then that's followed by everything kind of opposite: hypotension, tachycardia, tachypnea, which leads to respiratory failure and death. Okay. The thing that's kind of neat about cyanide poisoning is we use a drug that's called nipride for hypertensive emergencies. It's given by infusion. The body breaks it down to cyanide in the body. So what does the pharmacy do? They bring you a cyanide treatment kit, and it's kept at the bedside when a patient's on nipride. So these people, you want to put them on 100% oxygen, amyl nitrate or sodium nitrate, sodium thiosulfate. That's the cyanide kit. Hyperbaric oxygen treatment if you need it. Supportive